The tape you are about to hear contains an example of the voices and sounds a person with schizophrenia might hear while attempting to function in a job interview situation.
This job isn't right for you. You could never do this job.
You'll never get this job. Whoever called you a reporter?
You're such a loser.
This is a trick to fool you. You're so stupid. You're a joke.
You're not going to get hired.
Why would anyone hire you? You are incompetent.
Hello, my name is Paula Horky. I'm a registered nurse. I'm in a position currently called Clinical Nurse Specialist for Children and Adolescent Mental Health Programs within the Calgary Health Region. I've been in this particular position for 2 years, and the focus of my position is to be a resource to nurses who work with children and adolescents who have mental health issues, as well as with their families. This year's focus for Mental Illness Awareness Week was on stigma, and I've heard a number of youth and young adults talk about what it's like for them, for example, if they were admitted to the hospital, to go back to school and to be perceived by others as being different just because they had a mental illness, and how that turned into sometimes them being isolated and being bullied and called pretty nasty names. And so then they get into this mode of thinking that they're very different. That's a stress for them, their self-esteem goes down, and they oftentimes end up back in the hospital. A number of people throughout my years of working in mental health have let me know that actually the response that they receive from their family, friends, and community at large is sometimes more upsetting to them than actually having a mental illness. Oftentimes people will hear that if you have a mental illness, you kind of have a weak character and you just need to buck up and get over it. And if there's more at issue and they don't go for help, sometimes some pretty dramatic things can happen, and we don't like for that to happen, but they do, and that's what hits the newspaper and the media. And that's very distressing to me as a mental health care provider, because it reinforces in my mind the fact that if you come forward and ask for help, you could be put in the slot by other people that you're weak, that you're defective in some kind of way. And so we miss treating people who have illnesses that are very treatable, their stressors can be modified, and that they can lead lives that are more than what they sometimes think they can be. Please consider, when your friends or your family members are talking to you about maybe some things that sound like mental illness, please stop and remember to listen, to be supportive, and say you don't know what the answers are, but you'll help them find somebody who can help them. That will dissipate their anxiety and have them feel like they're not so alone. And that in and of itself is a treatment. Being a good friend means not putting somebody down because they've got an illness that you can't see or touch, but acknowledging that they do have some problems and are deserving of help. So thank you.